Hello, everyone, and thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I am your facilitator, Dr. Laura Fuller from the Department of Psychiatry. I have important information about this program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional advice. If you think you may have a medical emergency, call 911 or go to the nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties, express or implied, with respect to the information provided herein or to its use. We are absolutely delighted that you've joined us today. Please take note that additional resources are available at the loop on the hospital website. Our presenter today is Dr. Eyad Hanna, Clinical Associate Professor of Pediatrics. He serves as Assistant Pediatric Residency Coordinator, Pediatric Residency Program Director, and Medical Director of 9 Stead Family Children's Hospital, and he's a facilitator for the Provider Communication Program. Dr. Hanna is a pediatric gastroenterologist in the Stead Family Children's Hospital. The title for today's presentation is Someone's Personal Hero. During his presentation, Dr. Hanna will talk about getting help, giving help, combating stigma, and above all, recognizing that you're not alone. Here to tell you more without further ado is Dr. Hanna.
Hello. Thank you, Dr. Fuller. I'd also like to thank Sam Mitchell and Tara Kringle and the institutional leaders in wellness for all that you do and this opportunity to talk about accepting help. I'll just dive right in and tell you some of my story. And I've shared stories like this in other ways in some formal settings like Schwartz rounds, pediatric grand rounds, short articles in student publications, and more intimate settings, talking with my colleagues or sharing correspondence or emails. This is a little bit odd, maybe a little bit stressful, just talking to a camera, but I'm hoping I can reach some people who might help other people or need help themselves. And no matter who you are, doctors in training, students, nurses, medical assistants, administrative staff, really anybody who steps in the door of the children's hospital, the hospital in general, and works there to take care of other people. And I think it's important also for our friends or family who support us. So to get back to my story, I have a long history of depression, and I'm basically I'm a vulnerable person, and recognizing that about myself has been really important, which I have not always done very well when I've lost patients, especially if it was after a procedure I did. I've struggled, and it really has affected my life for many months or years at a time, making it harder to help people in the way that I would like, whether it was at work or in my home life. Some of the things that happen to us aren't obvious, aren't at work, aren't open for everybody to see. And so many of us struggle in ways that other people would never know, whether it's patients or coworkers, unless you just straight out told them about it, or they noticed something. So, in the last 14 years, I've lost 2 loved ones, and still recovering from the loss of my best friend, who was my age, since age 5, and it probably always will be, because part of the challenges we've had and work-life balance, I didn't see him for 5 years before his unexpected death. So I think we all choose to walk into the hospital because we think taking care of other people is important. No matter who it is who's coming to the hospital to work, that's why we're there. And I think we used to rarely role model how to care for ourselves. But this is an example of the fact that that's not the case anymore. Grand rounds about this, Schwartz rounds, debriefing sessions for everybody who might be involved with the care of a patient, the COPE team, employee assistance, training programs in the hospital, really putting a strong level of importance on wellness, even national organizations doing the same. That's been something very important in our hospital, clearly. I do my health assessment pretty much every year, personal health assessment pretty much every year. I feel blessed to work in a place like this where there are people looking out for you, starting from the top down. So no matter where we are in our lives, life can be stressful without a pandemic. And one of the important things, I think, is to just look around you and notice how people are doing. To acknowledge that we all have our agonizing moments, and that we may be going through things that other people won't know anything about. And it doesn't all have to be what we're dealing with at work. It can be what we're dealing with in our personal lives too. And sometimes they're so overwhelming that we cannot find joy in our lives, in our work, in our families, in our friends, pets. And that's a really sad thing when it happens. I've worked hard with the help of many people, including people in the employee assistance program, at recognizing better that this is a problem for me and also what I need, and built they sort of build themselves around me, the support group that I have both at home and at work. And one of my personal heroes still does this for me constantly. She's a coworker and a friend, and is not afraid to step up and tell me she notices changes, find out what's going on, and will not sit by and watch me struggle. And that's a skill, and I think it's a skill we can all work on, and learn to use better. Part of that is just taking the time, which I'm very grateful. This person is a personal hero of mine. The first time I went to employee assistance was because my friend noticed that I was distracted, looked tired all the time, not making jokes that I normally make, which, funny or not, I usually make the jokes. And she said, you need help. When I told her what was going on, in this particular instance, it was related to the loss of a patient. And so she not only gave me the number for employee assistance, she pestered me relentlessly until I told her, yes, I've called, and yes, I have an appointment. And that's one of the things. Life is so difficult and busy, period. No matter what's going on at work, what's going on at home is always busy. There's always something to do. And if you're lucky, that's something that you find time to do is spend quality time with your family. But there just never seems time to go get help for yourself, or you feel guilty about taking time away from your family or your work to go get help for yourself. Or you might feel ashamed to have to tell somebody, an administrator or a family member, that I'm going to be gone for this 50-minute period, because they're probably going to want to know why. because I need help with the things I'm struggling with. And so for me, it was critical to have somebody who was not going to leave me alone until I got the help that I needed. And I know if she didn't force me to do that, that I would have suffered maybe indefinitely, but definitely much longer. And so that was a present, that was a gift, not just to me, but my patients, my coworkers, my family, and all those people don't know that they got a better version of me because my friend pushed me to go get help. And so, you know, I don't know how many years into practice. It's now 13 years into practice with many years of training before that. So all the people that I have come across in medicine since 1996, when I came to medical school, have had some of these challenges. But I rarely heard anything about it. I sometimes noticed that maybe people I was working with seemed really more stressed out at times or others. And occasionally I would hear from somebody, you know, I just can't right now. I have to go pick up my kid at daycare, or I have this thing going on. And I've gone to some funerals for friends and colleagues who lost loved ones. But at work, we don't show it. We don't talk about it, or we used to not talk about it. But now we have things like Schwartz rounds, grand rounds focused on wellness. Like we said, the employee assistance program, the COPE team, and there's much more of a focus on it. And that's, I think, one thing we can all do is surround ourselves with people who care about us, and the kind of people who are not going to sit by while they watch other people struggle. It takes a lot of courage, especially if you're talking to somebody who is older than you, or not necessarily somebody that you're friends with. It takes a lot of courage to say, hey, I'm a little worried about you. And some of my other heroes are actually people I was training at the time who said, look, I've noticed you've lost some weight and you seem not yourself. I was wondering if you're okay. They were worried I had cancer. But they came like that small gesture to show that they noticed and that they cared meant a lot to me at the time. So I don't want to drone on too long. I just want to say that there are skills we can all practice to try and be better helpers for each other. And that's part of what drew me to this provider communication program that I'm part of, where we try and teach skills that people can use to connect with other people. And it's focused on patients and their families, but these skills generalize through life really well. And it feels a little weird saying things like, I can only try and imagine what you're going through, or boy, that sounds really hard. And it's really impressive that you've reached out for help, or that you're still coming to work every day. But when you make it a habit, it feels right, and it feels like you're really taking care of people. So I will just say we have a lot of resources to share, but please look out for each other. Don't ignore the changes you notice in a friend, a colleague, a family member, a learner, or a teacher. And sometimes just asking if someone's okay can make a difference, because you chose to walk into this hospital because you want to take care of other people. So if you do that for yourself and for your colleagues, people you work with, you could be somebody's personal hero, and maybe they can be yours.
Thank you, Dr. Hanna. That was wonderful, and a really eloquent reminder that we we're not only taking care of patients and, doing our jobs in that way as healthcare providers, but we also are taking care of each other and ourselves, and that's really important. A couple of questions for you. I loved what you said about how many of us struggle in ways that people will never know. In my work, I see that too, and I feel privileged to know the inside story, and that people will trust me and my colleagues with that kind of information. But you also touched on the idea of stigma, and that people can still, although things are changing, people can still be scared to speak up, to seek help, to say something to somebody else. What are some things that you like? What kind of pep talk have you used for yourself or others when you've been trying to help them help each other or help themselves?
I think it's sometimes you seed the pot when you're talking to somebody, and it takes some courage to say. Sometimes people going through what you've gone through, it's really hard. And I'm lucky to be part of some things like this. We also do a reflective practice session with first-year fellows in pediatrics. And you can say to somebody, what you're going through is hard. And I can only try and imagine what your journey is like. And when I was going through it, this was what it was like for me. And then for me, obviously, being quiet is very difficult. So then I try and be silent and listen, and then use the nonverbal encouragement, which is very difficult on video, which is how we interact a lot now, which is also difficult when you're in the hospital and you've got this mask and face shield and all they see is your eyes. And I've learned that the eyes don't always express what's going on underneath very well. So leaving the door open, and I found that if I ask in the right way, hey, how are you today? And then I'm willing to walk with the person out of my way if I have the time and I don't have a patient waiting for me, that sometimes you really hear how that person is doing. So I think if you lean in, hi, how are you doing today? Or how have things been? I think you're much more likely to get a true answer than what 99% of the time we probably say, which is fine, how are you? When in fact, you are not at all fine. So noticing when somebody says fine, but they really don't mean fine can help a little bit.
Wonderful. I love how you brought in a lot about nonverbal communication and listening as well, because I think we can all just out of our own discomfort or whatever, we may just plow forward when really what we need to do is wait and listen a little bit.
Yeah. I'll just add, I get made fun of a little bit because sometimes people cry when they're talking to me, and I say, it's not that I like it when people cry or that they have things to cry about, but I do feel happy that I was able to open a door and leave a safe space for them to really share their emotions in a real way. And by using some of the skills we were talking about that I've learned to be very deliberate about, I feel like I've really connected with my patients, my families. It's helped me in my home life and with my colleagues as well, be a better support person for all those folks.
Excellent. Another question I wanted to ask you is about your favorite coping skills, maybe besides the ones you've already talked about, like, having a support system and seeking help, but also, if you have any other favorites. I think that, I think you're going to say exercise, because I believe that the last time I was in your office, you had a desk treadmill, but I bet you have a lot of good tips here.
Yeah, exercise. Until I had influenza last year, that was really a huge thing for me. And now trying to balance it with getting physically back to where I was before, but also then having time for the spouse, the kids, the dog, and everything else. That's been a little bit difficult. I think finding that time is very important, but doing it in a way that's going to feel helpful to you, because it was really something, when I think people who have been severely depressed will probably all have their own stories. I think many of them will have some sort of connection with the idea that there's just noise in your head. It could be just constant static or screaming or whatnot. It's just there. And so exercise, which was a great thing for me, became kind of unpleasant because I'm running and all I have are my thoughts. So podcasts and sometimes music was helpful for me to help me just have a little bit of an escape. Playing with my children is wonderful, but after the loss of a patient, I felt this debilitating guilt every time I would play with my children, because that family was never going to play with that child again. So seeking help to work through those emotions so I could then benefit from the thing that was usually most helpful for me, instead of have it make things harder, was very helpful. So when you have one of the things just to think about and to get help for is when the thing that you usually love to do and that makes you feel better all of a sudden makes you feel worse. What an awful situation to be in. And I'll put in a plug. I don't know that it's in the resources that we're providing, but the sleep program that's provided for free by the university is phenomenal. It's horrendously difficult and phenomenal, because when you can't sleep because of all these other problems, just everything gets blown up so much. It's just so much more difficult if you can't sleep on top of everything else you're dealing with. But that almost universally goes along with feeling terrible.
Those are great ideas. Thank you so much. I'm curious about another thing that you mentioned, and it was about provider communication training, which I will say I've been through that training. I really enjoyed it. It felt very affirming, and I learned things that I try to use all the time. So for our last question, Dr. Hanna, I was wanting to ask if, in addition to some of the things you've already shared, if there are any other pieces of wisdom from the provider communication training that might apply that we could use to help others or ourselves as well as our patients.
I think probably the most helpful thing is something called pearls. It's like the pearls around your neck. It's a way to remember that the things that might be helpful in connecting with other people. So the P is for partnership, for example, and the E is for emotion. A is for appreciation or apology. So just the kind of things that you might think about, or the things that you might say to somebody who's struggling. So this can be a patient, a family, or a friend, or a spouse, or even a child. So using those statements as ways to help people. And we're often coming from a place of a good intention. We want to help, but sometimes you say something and it just doesn't land. And one of my favorite examples is, I can imagine what you're going through. And sometimes people will look at you, no matter where they are, what setting, and how can you imagine what I'm going through? Have you been, in this situation, or with my background? And so, especially as my background is Syrian, but I'm a white man, right, growing up in this country. So I can only try to imagine, what that must be like. Works much better than I can imagine what you're going through, even though both things, come from a place of, I really want to show you that I care. So it's helped me a lot in my professional life, but definitely in my personal life as well.
Thank you so much. And I want to say thank you, Dr. Hanna. We appreciate all the practical information that you gave us, especially during this time of coronavirus when we're all dealing with an extra layer of stress. Throughout the month of June, we will be offering new weekly pre-recorded wellness forums, so please stay tuned each Thursday. And also feel free to check out our previous wellness forums and additional resources on the loop. Until next time, take care.